Instituting trauma systems, getting them functional.
He's a Kelowna ER doctor who has spent the last 25 years using his skills to also help people around the world.
Their basic healthcare systems are so disrupted, and they've been hit by some natural disaster, often an earthquake or a flood or something like that, so they're in distress.
Dr. Doug Notabrock is a disaster response physician with Samaritan's Purse, and he's sharing his stories from the front lines, from the rise of war in the Middle East because of ISIS to natural disaster relief in the Philippines.
We have teams ready to go. I'm an emergency physician. I set up emergency field hospitals, and we go through processes and institute systems to respond to those disasters in whatever context, whatever the needs are.
The group was in Liberia when Ebola ravaged communities.
This was an unfolding catastrophe.
The numbers of new cases and deaths are still rising.
Notabrock is speaking up to help Samaritan's Purse raise money to continue meeting crisis needs around the world.
Medical is just one portion of our response, and we have food responses, food distributions, because there are populations in distress. We have non-food items, clothing, shelter, all this sort of thing, hygiene things, water, sanitation, and those are the main components to a disaster response team.
The group hopes to continue saving lives, reducing suffering, and sharing hope through their faith-based organization.
We are fundamentally all Christians, and we have that common thread, and then that calls us to respond to these disasters together as a group and as a network around the world.